Hello and welcome. Today we're delving into a rare and often misunderstood condition affecting the stomach, Ménétrier's disease. Join us as we explore its causes, symptoms, diagnosis, and management, offering a comprehensive overview of this unusual gastrointestinal disorder. The precise cause of Ménétrier's disease remains a puzzle, but research suggests a strong link with excessive production of transforming growth factor alpha, or TGF-alpha. This growth factor stimulates the proliferation of cells in the gastric lining. Certain infections, particularly with Helicobacter pylori and cytomegalovirus, or CMV, have also been implicated as potential triggers, especially in children. However, not everyone infected with these organisms develops Ménétrier's disease, indicating other contributing factors are likely at play, possibly genetic predisposition or immune system dysregulation. Ménétrier's disease fundamentally alters the stomach lining. The overproduction of TGF-alpha leads to massive enlargement of the gastric folds, known as rugae. This thickening primarily affects the body and fundus of the stomach, while typically sparing the antrum. These enlarged folds result in a significant loss of protein from the bloodstream into the stomach, a condition known as protein-losing gastropathy. The thickened mucosa also reduces the number of acid-secreting cells, leading to decreased stomach acid production, or hypochlorhydria. This complex interplay of structural and functional changes disrupts normal digestion and nutrient absorption. Ménétrier's disease is a rare disorder, affecting an estimated 1 in 100,000 people. It can occur at any age, but it is more commonly diagnosed in adult males, typically between 30 and 50 years old. In children, it is often a self-limiting condition associated with CMV infection, with symptoms resolving after the infection clears. However, the adult form is more persistent and carries a greater risk of complications. The signs and symptoms of Ménétrier's disease can vary, but the most common include epigastric pain, or discomfort in the upper abdomen, nausea and vomiting, unintentional weight loss due to malabsorption and protein loss, and edema, or swelling, in the legs and ankles caused by low protein levels in the blood. Some individuals may also experience fatigue, loss of appetite, and in severe cases, complications such as gastric bleeding or an increased risk of gastric cancer. Diagnosing Ménétrier's disease requires a combination of clinical evaluation and diagnostic testing. Upper endoscopy, where a thin, flexible tube with a camera is inserted into the esophagus and stomach, allows visualization of the enlarged gastric folds. Biopsies taken during endoscopy are crucial for confirming the diagnosis by examining the characteristic changes in the gastric mucosa under a microscope. Blood tests are also performed to assess protein levels and rule out other conditions. Gastric acid analysis can confirm hypochlorhydria, ruling out other conditions that can cause similar symptoms, like Zollinger-Ellison syndrome, is also important. While there aren't distinct types of Ménétrier's disease as such, it's helpful to differentiate between the adult and childhood forms. The childhood form is often acute and self-limiting, usually linked to CMV infection. The adult form is typically chronic and requires ongoing management. Treatment for Ménétrier's disease focuses on managing symptoms and addressing the underlying cause if identified. If H. pylori infection is present, eradication therapy with antibiotics is crucial. For CMV-related cases in children, antiviral medications may be used. Proton pump inhibitors, or PPIs, can help reduce acid production. A high-protein diet is essential to compensate for protein loss. In severe cases, where symptoms are debilitating or complications arise, surgical removal of part or all of the stomach, known as partial or total gastrectomy, may be considered. Monoclonal antibodies that block TGF-alpha signaling are also being investigated as potential therapeutic agents. Currently, there's no known way to definitively prevent Ménétrier's disease. However, maintaining good hygiene practices to minimize the risk of H. pylori and CMV infections may be beneficial. Prompt treatment of any identified infections is also important. The prognosis for Ménétrier's disease varies. In children with CMV-related disease, the prognosis is generally excellent, with symptoms resolving after the infection clears. In adults, the condition is typically chronic, requiring ongoing management. The risk of gastric cancer is increased, so regular endoscopic surveillance is essential. Recent research has focused on the role of TGF-alpha and the development of targeted therapies. Studies are exploring the use of monoclonal antibodies to block TGF-alpha signaling, potentially offering a more effective and less invasive treatment option in the future. Continued research is crucial to improving our understanding and treatment of this rare and challenging disease.